Your Skinstructors tip of the week. If you have a client who constantly apologizes for their skin, pay attention to that. Sometimes they'll sit down in your chair and immediately start saying things like, I know my skin is terrible. I know I shouldn't pick. I know I messed up everything. And honestly, that's usually your sign that they're carrying a lot more than just acne. As estheticians, we're not just treating, we're working with people who may be struggling with confidence, anxiety, stress, perfectionism, or years of frustration surrounding their appearance. The treatment room should feel like one of the safest places they go to all month. So this week, focus on replacing correction with curiosity. Instead of immediately saying, you need to stop picking your skin, try asking, when do you notice yourself wanting to pick the most? That simple shift can completely change the conversation.
Welcome back to the Skinstructors. I'm Morgan.
And I'm Jolie.
Today we are so excited to launch our month-long series of talking about acne subjects because it is Acne Awareness Month.
Absolutely.
Today's episode is one I think a lot of people are going to connect with, whether they're an esthetician, a skincare professional, or someone who's personally struggled with acne. I know that story that you were telling us, Jolie, definitely resonated. I've been there. It's really tough. Yeah. Today we're going to talk about skin picking, acne eczema, and the mental side of breakouts.
Yeah, and like Morgan was saying, like this topic really hits home for me. I mean, I know I've been dealing with skin picking and acne since I was probably like 12 or 13 years old. And even after becoming an esthetician and understanding, inflammation and healing and pigmentation and everything else that goes with it, it's still something that I do really struggle with is picking at the skin.
Which is exactly why we wanted to have this conversation, because people often think that skin picking is just a bad habit. But for individuals like you and me, it's much more complex than that.
Absolutely. There is psychology involved with it. There's emotional regulation, some anxiety, perfectionism, and sometimes even obsessive thoughts, sometimes body-focused repetitive behaviors. And as estheticians, we need to understand the whole picture if we genuinely want to help these clients.
So let's start with acne eczema. Acne eczema is a condition where acne lesions are repeatedly picked, squeezed, scratched, or manipulated, creating additional damage beyond that original breakout itself.
And what's interesting is that sometimes the acne isn't even severe. You may see a client with a few active lesions, but dozens of red marks, scabs, open areas, hyperpigmentation spots, and healing wounds. And the picking often becomes more damaging than the actual acne.
Exactly. The skin ends up fighting two problems at once: the original inflammatory acne process, and then you have that repeated physical trauma.
So why do people pick? This is where things become a lot deeper than just skincare. People pick for a lot of different reasons, and we've even mentioned some already, stress, anxiety, perfectionism, boredom, sensory stimulation, and a desire for control. And then sometimes it's completely conscious, and sometimes it just isn't.
I think that was me. Thinking back to when I struggled with acne, I don't remember ever thinking about it. I definitely didn't realize I was picking until suddenly I have a face full of acne scars. And, a lot of people describe that feeling like if they can fix one blemish, they'll feel better. For me, it wasn't about that. It was just I just had my fingers on my face.
Yeah, and sometimes clients become hyper focused on the texture. They feel that tiny bump, they see that clogged pore, and they notice that little bit of roughness, and then suddenly they're standing in front of a mirror and they're trying to make their skin perfectly smooth. And I've caught myself doing this a few times. If I'm at my desk with my hand on my face and I feel that bump coming, I feel that texture, I want it off my face.
Yeah, which is impossible.
Yeah.
Healthy skin has texture. Healthy skin has pores. And healthy skin has those sebaceous filaments. It's not airbrushed.
And unfortunately, social media has aided in distorting people's perception of what normal skin can look like. And we're constantly seeing the filters, the editing, and some unrealistic standards. So people start examining their skin looking for the flaws. And once they really start to search, they're usually going to find something.
Yeah, and this is also a great place to introduce a term that more estheticians should know, BFRBs, or body-focused repetitive behaviors.
Yeah, BFRBs are repetitive self-grooming behaviors that can cause physical damage to the body. This includes skin picking, hair pulling, nail biting, cheek biting, lip biting, and similar repetitive behaviors.
And it's important to understand that these behaviors exist on a spectrum. Most people have tweezed away a stray eyebrow hair, and most people have picked away a scab. Most people have squeezed a pimple. That doesn't automatically mean someone has a body-focused, repetitive behavior disorder.
Exactly. There's a huge difference between just normal grooming and a repetitive behavior that's causing distress or physical injury. Tweezing a few stray eyebrow hairs is normal. Removing an occasional chin hair is normal. And touching a blemish, a few times isn't necessarily a problem.
Right. The concern is when that behavior becomes difficult to control, and when someone spends significant amounts of time picking, or when they're creating wounds, or even to the point where it's causing pigmentation or scarring, when they're repeatedly trying to stop and finding that they just can't.
A lot of people almost describe this as going on like autopilot. They sit down in front of the mirror planning to look at one thing, and then suddenly, they're there for 30 or 40 minutes and this time's passed and they don't know where it's went.
Yeah, and one thing that can absolutely contribute to that cycle is that damn magnifying mirror.
I know this was my problem. I had to pitch mine.
Good. I'm glad you did.
Yeah. And I know that some people are going to hate hearing that, but magnifying mirrors can be incredibly triggering for people who struggle with skin picking. When you're looking at your skin under this bright lighting and even 5 or 10 times magnification, you're seeing details that no one else is seeing. Every pore, every tiny bump, every sebaceous filament, every little piece of texture on your skin.
Yeah, and then suddenly that normal skin starts to look abnormal, and clients start trying to remove things that were never actually problems in the first place.
And honestly, reducing the magnifying mirror use is sometimes one of the simplest interventions that we can suggest, not because mirrors are bad, but because for certain people, they really do become part of that picking cycle.
Something else that's important to understand is that BFRBs are classified within obsessive compulsive and related disorders, but they aren't exactly the same as OCD.
People often hear OCD related and assume they're identical, but they're not. With OCD, there's usually an intrusive thought or an obsession that creates that anxiety, followed by that compulsion performed to reduce the anxiety.
While with skin picking, the behavior is often more sensory based, soothing, automatic, or emotionally regulating rather than being driven by a specific intrusive thought.
And with that being said, anxiety, OCD, depression, ADHD, and other mental health conditions can absolutely exist alongside skin picking behaviors, which is why it's important we approach clients with compassion rather than just judgment.
Now let's talk about what picking actually does to the skin. Every time we pick, squeeze, scratch, or reopen a lesion, we're creating trauma, and that trauma triggers inflammation.
And inflammation means more redness, more swelling, more healing time, and more opportunity for pigmentation, and sometimes even a greater risk of infection.
Yeah, what could have healed in a week can easily turn into several weeks or even months because the skin never gets a chance to fully complete that healing process.
And one of the biggest frustrations for these clients is the post-inflammatory hyperpigmentation. The pimple may be gone, but that red mark is still remaining, or brown mark is still remaining.
And that repeated trauma dramatically increases that risk, especially in medium and deeper skin tones.
Then over time, we can start seeing some textural changes, atrophic scarring, permanent indentation, long-term damage that often has more to do with the repeated picking than that original breakout itself.
One thing I really want estheticians to take away from this episode is that shame is not an effective treatment strategy.
Yeah, telling someone you just need to stop picking usually isn't helpful. If it were that simple, most of them probably would have already stopped.
Right. They don't want to pick.
No.
Instead, you can ask questions like, what do you notice yourself? When do you notice yourself picking? Do you pick more when you're stressed? Do you notice any triggers? Or do you find yourself doing it while scrolling on the phone or watching TV?
I like that question.
Yeah.
Those conversations can create awareness, and awareness is often where progress is going to start.
We also have to create realistic expectations because if a client is actively picking every single day, we can't expect perfect skin immediately.
Absolutely. Maybe the goal isn't complete clearance yet. Maybe the goal is just reducing picking frequency, or maybe it's decreasing the inflammation, and maybe it's even helping those lesions heal faster.
And many of those clients need barrier support before aggressive acne correction.
Yeah, if the barrier's damaged, think about your calming protocols, your barrier repair, your ceramides, cholesterol, fatty acids, niacinamide, beta-glucan, ingredients that support healing and reduce the inflammation.
Yeah, sometimes going harder isn't the answer. Rather, sometimes the skin just needs less stimulation and more recovery time. So let's talk about some practical things we can recommend to clients who are actively trying to reduce skin picking. Because telling someone to just stop picking isn't a strategy. You have to give them the tools.
Absolutely. One of the first things I often recommend is creating some distance between themselves and the behavior. And sometimes that starts with the environment. So if the client has a magnifying mirror that's part of their picking routine, it may be time to put that away for a little while.
Yes, absolutely. And I know some people love their magnifying mirrors, but if every evening turns into a 30-minute skin inspection session, that mirror may be doing more harm than good.
That's what was happening to me.
Yes, it was.
Remember, healthy skin has texture. When they're viewing their face under 5 or 10 times magnification, they're seeing details that no one else notices, and removing that trigger can be incredibly helpful.
Another simple strategy is covering the bathroom mirror during times when clients are most likely to pick. And that might sound extreme, but for some people it can be surprisingly effective.
Yeah, I actually have an example of this. So in my bathroom, at my apartment, I have my regular mirror over the sink. And then for some reason, I have a medicine cabinet to the side with a mirror. And that's the mirror that, because I can't see that well without my glasses, I can see because it's right up by my face. And that's when I could just go to town. So covering that mirror up is something that is super helpful because my mirror above the sink, I can't see as well, and it doesn't make me want to pick as much. Yeah. I've had clients also, tell me that they put a towel over the mirror after their skincare routine so that they're not tempting to keep examining their skin. And sometimes the goal isn't the willpower, but it's just reducing that temptation altogether.
Another thing I love to use is cold therapy. So if someone feels the urge to pick, try icing your skin instead. You could still get that sensory experience, but using the chilled globes or a cold jade roller, you can even use like a facial roller. It really helps with picking.
Absolutely. And not only does it do that, but it's going to help reduce the inflammation, and the cooling sensation can help provide some of that sensory input that people are often seeking when touching their skin. Plus, they're calming redness instead of creating more of it.
Something else that can help is creating a physical barrier. So keeping a pair of gloves near the bathroom sink. I know it sounds crazy, but it works.
It does, because I mean, it sounds simple, but if you have to stop and put gloves on before touching your face, it does create that pause between the urge and the action. And honestly, it can help remind people that picking with dirty fingernails is introducing bacteria. It's increasing that risk of infection and maybe even spreading it more across the face.
Yeah, even that few seconds of interruption is enough to break the cycle.
You can also encourage clients to identify patterns. Do they pick when they're stressed, when they're studying, watching TV, scrolling social media, lying in bed, or standing under some bright bathroom lights?
The more awareness that they build around their triggers, the more opportunities they have to redirect the behavior before it starts.
And I think that's an important point. The goal isn't perfection. The goal is progress. And if a client picks less often this month than they did last month, that's a win. If they're healing faster, that's a win. And if they're becoming more aware of their triggers, that's a win, because small changes can add up to those significant improvements over time.
Love that.
So as estheticians, we're obviously not diagnosing mental health conditions, but we can kind of recognize when additional support could be beneficial to a client.
Yeah, if picking is causing significant wounds or emotional distress, social avoidance, even infection or scarring, or feels impossible for the client to control, it may be appropriate to encourage them to seek professional help.
Therapists who specialize in cognitive behavioral therapy, habit reversal training, and body-focused repetitive behaviors may be part of that support system. Some individuals may also work with psychiatrists regarding medication options when appropriate.
And that referral isn't a failure, it's collaborative care, just like referring someone to a dermatologist when something falls outside of our scope.
Absolutely. Okay, so your homework this week is to pay attention to your language when discussing skin picking. Think about how you respond when a client says, I know I shouldn't pick.
Are you responding with frustration or curiosity, correction, or compassion?
I also want you to take a look at your consultation forms and intake process. Do you ask questions about stress, anxiety, behavioral patterns, triggers? Because sometimes those answers are just as important as knowing what cleanser they're using.
And if you're someone personally struggling with skin picking, your homework is simple. Start noticing your triggers without judging yourself for them, because awareness comes before change.
Love that. Well, thank you so much for spending part of your day with us.
If you enjoyed today's episode, be sure to rate, review, and subscribe. You can follow us on Instagram at SDTraining and visit us online at www.sdtraining.com.
DM us with any questions, and we'll see you next week.
And remember, don't hesitate to educate.